Okay, welcome everyone to our morning plenary session, the role of policymakers in advancing health equity in sickle cell disease in Ontario. I'm Dr. Jennifer Bryan, co-chair of the Sickle Cell Summit 2022, along with my colleague Karen Fleming. As Dr. Oyedeji Ayarindi sends his regrets and is unable to moderate today's session due to unforeseeable circumstances, I'm going to be your moderator today. I'm very pleased to welcome MPP Rudy Cuzzetto and MPP Andrea Kangin. MPP Rudy Cuzzetto is a lifelong resident and passionate advocate for the lakefront communities of Mississauga Lakeshore, where his family's roots run 4 generations deep. Before being elected MPP in 2018, he worked at Ford Motor Company for 31 years, most recently as a vehicle auditor. In 2019, Rudy was appointed as parliamentary assistant to the president of the Treasury Board with responsibility for the Ontario Internal Audit Division. He has also served on the standing committees on agencies, estimates, finance and economic affairs, and public accounts. In 2021, Rudy co-sponsored a bill with Andrea Kangin, MPP for Barrie Innisfil, to proclaim June 19th in each year as Sickle Cell Disease Awareness Day in Ontario, to help raise awareness of this condition in our schools, workplaces, and hospitals across Ontario. Together with his wife Marie and sons Michael and Joey, MPP Cuzzetto lives in Lorne Park, where he has served on the local Ratepayers Association, parent councils, and as a board member and property manager at the Mississauga Canoe Club. I will be introducing MPP Andrea Kangin shortly, but to start off with, I will turn things over now to MPP Cuzzetto.
Okay, so thank you very much. It's a real honor for us to join you here today at the 2nd Annual Sickle Cell Summit to speak about the role of policymakers in promoting health equality. First, I want to thank the summit co-chair, Dr. Jennifer Bryan, and Karen Fleming, and everyone who is joining us this weekend, including doctors and patients, and advocates like Landry and the Sickle Cell Awareness Group, who are working to raise awareness every day. I understand that over 400 are watching, which is fantastic. As you all know, sickle cell disease is the most common inherited blood disorder and one of the most common rare diseases in the world. Over 3,500 people in Ontario are living with this disorder, and over 150,000 carry the sickle cell gene. It can damage every organ in your body, including the brain, the heart, the lungs, and the congestion can be devastating, from serious pain and infection, and ultimately a life-ending far too soon. Despite this, and despite the fact that this disease is well known, we know about sickle cell disease for over 100 years. Treatment and care for patients is often limited, and resources and research often lag far behind other rare diseases that affect a similar number of Ontarians. This is a healthy equality issue because, as you know, while sickle cell disease can affect everyone, it is most common among you Canadians and Canadians who trace their roots to Africa, Asia, South America, the Caribbean, and the Middle East. Thalassemia is a related blood disorder. It is very common in Italians from the region of Calabria, which my family's left 4 generations ago. So I understand that discrimination and inequality and mistreatment of sickle cell patients have led to preventable harm, both in Canada and around the world. This is unacceptable. This is why Andrea and I were so proud to introduce our bill last year in Ontario to officially proclaim Sickle Cell Disease Awareness Day each year on June the 19th. This was just a small step, but we also know that with great awareness will come more support, more research, more better treatment, and better cures for this disease. Mary Alfano from my city of Mississauga said, "Our bill marks the beginning of a new era." She said, "I see professionals working together to educate and inform people, and I see a bright future for these kids." Andrea and I are so grateful for the opportunity we had to work together with Landry and the Sickle Cell Awareness Group towards a more compassionate and a stronger healthcare system. And I can give you just a few examples of this. Around the time our bill passed in June last year, we worked to ensure people living with sickle cell disease and other high-risk conditions were given priority access to COVID-19 vaccinations in Ontario. Second, I can give you an example from my community in Mississauga. After our bill passed, Dr. Ann Bayless, the other from Trillium Health Partners, reached out to my office. Together, we know working to set a clinic for sickle cell patients in Mississauga, similar to those in Brampton and in Scarborough. We already have the largest clinic in Ontario, so we're looking to use this exciting infrastructure to serve our growing multicultural population with much needed comprehensive care closer to home. And this is only just the beginning. Together, we're working to educate and this disorder in school and in working across the province to help raise awareness about the importance of early detection, effective treatment, and prevention. In closing, I just want to thank Landry and all the doctors, patients, and advocates who shared their story with us and supported our bill. Andrea and I look forward to working with you to continue making our health system better, more compassionate, and more equitable, and to make life easier for those living with sickle cell in Ontario and in Canada. Thank you very much for giving me this opportunity to speak to you.
Thank you so much, MPPCuzzetto. It's wonderful to hear about the advocacy work that you're doing, the things that are coming up in the future. I know that that so many people who are participating today have directly benefited from the advocacy work that you've been doing. So we're very grateful for that and for your participation today. I've received word that unfortunately MPP Kanjan is not going to be able to join us this morning, but we appreciate you being able to talk about your experiences and passion on behalf of both of you. We're going to take a moment to show a short video from Sylvia Jones, Minister of Health. And then I hope, MPPCuzzetto, that you'll be able to join us for a Q&A afterwards.
Perfect.
Excellent.
Perfect.
Thank you so much. Okay.
So, Ika, you can play the video for us, please, and thank you.
Hello everyone, I'm Sylvia Jones, Ontario's Deputy Premier and Minister of Health. On behalf of Premier Ford and our entire government, thank you to the Sickle Cell Awareness Group of Ontario for organizing this year's summit and for your ongoing commitment to support individuals and families living with sickle cell disease. Your leadership, passionate advocacy, and determined efforts have been instrumental in improving access to specialized care and treatment, as well as addressing systematic barriers and supporting research and education about sickle cell disease. As part of our government's commitment to building a more connected equitable, and inclusive healthcare system, we're working to improve health outcomes for all Ontarians living with rare diseases. Funding sickle cell disease clinics across the province is a significant step forward, and our government will continue working with our many partners, including the Sickle Cell Awareness Group of Ontario, to ensure Ontarians get the care and support they need when they need it. Thank you for participating in this year's summit and for everything you are doing to support patient-centered healthcare in Ontario.
All right. Well, thank you so much for sending that video of support, Minister Jones. We're certainly very grateful for that engagement with the work that's happening to advance sickle cell care. We'll open things up for Q&A. I invite all of the folks who are participating to go ahead and put your questions into that Q&A, and we can address some questions to MPPCuzzetto. Maybe I can start off with one, and I think it's a question that comes up often, is a lot of folks are not comfortable or not aware of really how to engage their government representatives in advocacy work. So if someone is very passionate about something that they're working on, and that they think that they would benefit from having a support at that level, what kind of advice would you give them as first steps?
Well, my first thing of advice is contact your MPP, just like Landry did with me about sickle cell. And, at first I said, okay, let me, do some research on this blood disorder, because I did not know much about it. And, and that's very logical. We can't know everything about everything that's out there. Like myself, you're not even aware of this. I have a mechanical heart valve, and, and I've learned a lot about the heart valve, because I had it done 12 years ago. And be honest, I'm probably going to be doing a private member's bill for heart valve awareness, right? And this is because we should be aware of everything that is out there. And if it's possible, like, more that we do, the better it is, because there's less chances that we, end up in the hospital. And with the stress on healthcare now in the province of Ontario and across Canada, we have to do whatever possible to bring awareness to people, so we can avoid, if possible, going to the hospital, because we can treat ourselves at home, or, from your family doctor, so we don't have to end up in the hospital to put more strain on our healthcare system. But it's very easy to, contact your, your local MPP. I'm very, willing to talk to anybody, and talk about any issue out there, and to see what we can do to move it forward, and improve everything in the province of Ontario, not just healthcare, but everything, right?
Thank you so much for that. I think that you might be getting a number of calls after this session with an invitation like that.
Probably will, but you know what? That's fine with me. Be honest,
thing.
I like listening to people, because you learn a lot out there. And like, even I did another private member's bill. It was Hungarian Heritage Month, and some people go, "Well, a son of an Italian immigrant is doing Hungarian Heritage Month," and the reason I did it is because I look back in my own history. My doctor, my family doctor, which delivered me at the time, was Hungarian. So that was the first face I saw, was a Hungarian face, really, when he delivered me. Then I looked at, I worked for Ford Motor Company, and Frank Hesenfranz, which was Lidamar, was the one that produced fuel pumps for Ford Motor Company and kept me employed, really, if you really look at it. Then I looked even further. I go, well, Peter Monk, he was a philanthropist that gave $100 million to the Toronto General Hospital, where I had my heart valve replaced, right? Then I looked at Thomas Budai, which was a Hungarian canoeer that taught my kids how to canoe and kayak out of the Mississauga Canoe Club. And then I go, look at Peter Bethenfaldi, which was the president of the Treasury Board and now the finance minister. And I worked for Peter as his parliamentary assistant. So like these are Hungarians that have touched me through my whole life. So, and so there's a lot of things in common. And, this blood disorder. Thalassemia is more of a blood disorder for Italians from Southern Italy, where my parents come from. So, like, it's all connected. If we start searching, we're all connected in some way or another. So it's very important to, speak to your MPP, like we're going back, and, and having these issues try to be resolved moving forward.
Thank you so much for that. I think it really speaks to the importance of those personal connections as well. Hey,
Yeah.
we have a number of questions now that are coming through the Q&A, which is fantastic. Love to see that degree of engagement. Please keep them coming. And I see that Ms. Lanre Tunjiajayi, who is the president and CEO of the Sickle Cell Awareness Group of Ontario, has her hand raised. Lanre, would you like to ask a question of MPPCuzzetto?
Thank you. Good morning, MPPCuzzetto. It's so nice to see you.
Nice to see you as well.
Thank you. I just wanted to just add that I find that, from some of the sessions we've done on advocacy, some of the families, they feel intimidated. They don't think that they can reach out to their MPs or their MPPs, but they are elected officials to support you. So they are there. And I know sometimes, because for us, when we go to people who are not of Black heritage and we're talking about sickle cell, they might not, like yourself, the MPPCuzzetto, not too aware of sickle cell disease in the beginning, but we were engaged with yourself and you were willing to help us. And you say, let me look at it. Let me research what sickle cell is. And let's see how we can be of help. When I also met with MPP Andre Kajin, she said, I don't know what sickle cell disease is. And I said, yeah, but you can still help because you're my MPP and I need you to help me. And so I think, don't be shy, get to know them actually before you need their help. Book an appointment, go meet your MPP, introduce yourself and let them know what is important to you, right? And they will be able to help you. So I just want to say that they're there for you to work with. And so please, let's keep on working with them together in the community. When you do meet with them, make sure you talk also about sickle cell is important to you and SCAGO is working with you and let's work together. Thank you.
Thank you. And I agree with you, lad. I'm just a regular person, just like you guys. And, yes, I am elected, but, I always say, remember where you came from. And I think that's the most important thing. Like my mother was a custodian. My father was a welder at a refinery here in Port Credit at the time. So, always remember where you came from, because as soon as you forget where you came from, you're nobody. So remember your roots and how you became the person you are, and respect everybody. And I think that's the most important for any, doesn't have to be just a politician, it could be a doctor or whatever. Just remember where you came from. And I think that's the most important. Like, my office is always open and I'm willing to speak to anybody on any issue. We might not always agree because, sometimes we can't, but let's have the conversation at least, right?
Absolutely. I think that's such a great approach. That, yes, there's going to be differences of opinion, but it's the conversation and that communication that really gets things moving forward.
It's true.
Now, going to turn to some of the questions that we're getting in the Q&A. There is one question that's specific to analgesic choices in sickle cell, and I might ask the person who's asked that question. I think that might better be directed to some of our healthcare providers that will be speaking a little bit later on today. So we have a series of our hematologists and other clinicians that will be providing some of the upcoming simultaneous sessions, as well as the sessions yesterday that are still available as recordings. And so I think there would be some additional insights there. For MPPCuzzetto, I see another few questions that that I think would be interesting to hear your perspective on. There are two that are talking about the social determinants of health. So about engaging politicians to address issues around poverty and housing. In particular, one participant points out that ODSP is $1,228 per month, and people with sickle cell disease may rely on this. given that the average cost of rent for a one-bedroom apartment in Toronto is upwards of $1,400 a month. What are the plans from the government to address these issues?
And it's a very good question, and it's the problem about that question there. It's really a lot of different issues to one issue.
Yes.
ODSP, as you're aware, we have increased it more than ever before. And I know that people say it's always not enough because of the cost of rent out there. But I'll touch on the rent issue. There's an issue out there. It's called supply and demand. And we have to build more houses and more affordable houses. But we have always pushback from communities. And you probably heard the word NIMBYism, right? You want to build affordable homes, but they say, oh yeah, we want them, but not here. We want them somewhere else. And then you build transit, and transit comes with density, right? And like down here in Port Credit, I have the prime example. I grew up here. My family was, we're building an LRT from Lakeshore all the way up here, Ontario. And the plan is when you build an LRT, you got to build density around it, but the community does not want that density. So I said, well, the problem I have is that, I have 2 million people moving into the Golden Horseshoe in the next 10 years, and probably even more because now the federal government has increased immigration. So I said, I need 1.5 million homes. But I go, I understand you don't want them right here. But I go, you're the same group that complains about a highway 50 kilometers away to move density from down here up there. And, they looked at me and they started agreeing. They said, you're right, Rudy, you're right. We don't want density, but then we don't want a highway to move the density up there. And they go, you're totally correct. I said, well, that's the situation I'm in. We can't build if you don't agree. And there's a new word out there. It's not called NIMBYism, which most of you have heard, NIMBYs, right? The word is now banana, and it stands for build absolutely nothing anywhere near anyone, right? So that's the new term, right, out there, and it's true, and that's the problem with policymakers, that we want to build homes. We have to work with these developers or community builders. Like I look at it, like we have a project here in Port Credit at the GO train station. The community did not want a parking structure, so we said, MTO said, okay, you don't want a parking structure, we'll sell the parking lot. So they did sell the parking lot. So now the community is saying, well, we need parking for the cars that go to the GO train station. So the gentleman that bought the property said, yes, I'll build you parking, right, underground, but it costs $120 a spot, $120,000 a spot. He goes, I'll build you no frills in here, and I'll build you affordable homes, but instead of 22 stories, I want more because I have to compensate for the cost. Right? And it does make sense. Like we have to work together. If we don't work together, sickle cell, whatever, housing, ODSP, nothing will get done. We got to work together, have the conversation, and at least get to where we want to go.
Thank you so much, MPPCuzzetto. I think that is a very good note to end off on, and really is a theme that's been flowing throughout the summit, right? The idea of coming together, of having that open communication. This summit having healthcare professionals and people living with sickle cell and community members and other advocates and policymakers. That is the type of communication that we're hoping to move forward. And we're very grateful for you being a part of that this morning and in all your advocacy work.
And I don't know if you're aware that we're building the largest hospital in Canadian history in my riding of Mississauga Lakeshore. And I'm so proud of this hospital. It's because I was born at the original hospital, and it's a full circle for me. Now, like we're building a 24-story hospital, 23 surgical rooms, the largest emergency center in Canada. So this is great news. And let's be honest, I think there was a silver lining to the pandemic, because for many years, every government, even our governments before that, have neglected healthcare and long-term care, right? Because it's not glamorous. Let's be honest. Building long-term care is not. So governments don't want to do it, but we're doing it. We're building long-term care. We're building healthcare. We're spending $40 billion on infrastructure for healthcare. We're spending $64 billion on long-term care. Like, you know, we're building 30,000 new spots, plus we're rebuilding 28,000 new, 30,000 and 28,000 reconditioned facilities. Like, we're looking at 58,000 new long-term care beds out there, which is still not enough. Let's be honest, with the aging population, the baby boomer, but we're doing it compared to previous administrations that only built 611 beds. Like, we're at 58,000. This is great news for the province of Ontario, but we got to continue having the conversation and working together.
All right. Thank you so much. Thank you again for taking the time to join us this morning.